On January 12, 2010, Haiti was rocked by a 7.0 magnitude earthquake. Hundreds of thousands of people are dead, and millions are left homeless, hungry, and sick. International Medical Relief has treated thousands of Haitians since the earthquake.
Last night, as I was sitting here and a helicopter flew over, I said, you know, this is just like being in an urban war zone. If some enemy army had come through and dropped scatter bombs and then left, this is just what it would be like. It's absolute total chaos. There's absolutely no support. It's literally a day-to-day existence.
Our team stayed on the roof of the police headquarters overlooking the presidential palace of Haiti. A stunning view. The palace, as most people have seen, collapsed. We got to walk right by that and see that up close. And it's an image that really tells how bad things are here in Haiti. If the presidential palace can go down, many, many more things can and have. So we walked by that, and then our guide walked us through the tent city. And that was very, very compelling. Once again, the people were very friendly. We were walking right next to their new homes. They're really just either tents or made out of lumber and old shed material, it seems. And the people looked us in the eyes and smiled and didn't seem bothered with us there. The children played with us, and it was really very interesting, and they seem to be going on with daily life. The third day we were here, the Ministry of Finance building collapsed. Several times on our trip here, there were building collapses and some of the patients would be brought to us. We walked by that scene a few hours later, and it was incredible.
Y'all took a look right now. This is the building that just fell, and IMR just sent one of the victims, and Duke said that there was 8 of them inside of the building, and as soon as fell, and only him rescued, and the others dead.
During that day, they pulled, I believe, 13 bodies out from that building that had been staying in there. There were many Haitians walking amongst the ruins, looking for lumber or anything they could use to build their homes. We saw Haitians in flip-flops walking on these 30-degree roofs, tearing the roofs apart to use them as shelter.
After the earthquake, Kleneone and Zedoe live in this tent city, in this home, with 3 other family members. Zedoe barely survived the earthquake.
And the earthquake, it was really tragic for us, not only for us, but for all the Haitians that was in Haiti at that time. Because that Tuesday afternoon, anybody didn't expect something like that would happen. I was into my house, watching TV with my whole family. Then we felt like the house was shaken. Everything was shaken. Then we were all scared. I was about to run out, then a friend of mine told me to stay. Then there was a big holes falling down. Then I'm telling you, fortunately, I'm alive today.
We have a lot of stories that can come out of this church. One that's pretty personal, I guess, my sister, my older sister, she was literally 20 seconds from going inside of her university for class. Somebody stops her in the street to talk to her. She was rushed. She didn't want to stop to talk, but she stopped and the guy held her for another 30 seconds as they watched as the building fell down in front of them. She would have been inside if it wasn't for that man that stopped to talk to her.
The IMR team this week consisted of 35 people. Some of these people were physicians, some surgeons, some general practice physicians, some nurses, some wonderful support personnel who helped clinic run properly, and really, truly, the team pulled together as one single team to treat thousands of patients in 1 week. As the team leader, my responsibility is to make sure that people get where they're going safely and have the ability to practice medicine. I organize the clinics, I make sure that we have transportation, and I make sure that we're safe while we're on any trip, whether it's to Haiti or it's to anywhere else in the world. The way a clinic runs from start to finish is that as we arrive, we have many duffel bags full of medicines. Some of these medicines are prescription pharmaceuticals, others are over the counter, a great deal of wound care, anything else that we think we might need to run clinic. We try to have a translator with every doctor, and nurses provide a great deal of our community education, our well checks, help with our babies, and do many pieces of it, including wound care, that we could not do without them.
This is a village in Creole, we call them bidonville, where obviously there's a lot of people in there when they live right next to each other. I mean, it's very poor. Most of the people live are very poor. They live just day by day. It's basically it, and everybody here to help because they've all been touched by the earthquake.
In addition to mobile clinics such as this one, International Medical Relief also provides staff for the General Hospital.
When the patients come into the hospital, their families do most of the taking care of them. In fact, I was extremely impressed in the way families gave such care to their loved ones. They stayed with them all the time. They bathed them. They gave them food. Actually, there's very little nursing support. So that was one of the nice things to see, is how much those families loved those people. Most of them were old people who were dying, and they cared for them very much so.
Pediatricians are critical on a team like this. We see many, many children. And in a country like Haiti, many of these children are so dehydrated that they're very close to death. So one of the things that we do is we try to bring a pediatrician and a pediatric nurse to evaluate these patients and get some IVs started.
So this little girl came in by herself with vomiting, nausea for a couple of days, and she hasn't eaten since yesterday. She's severely malnourished and dehydrated. We tried to give her some Zofran and some Tylenol. She's got fever also, but she threw it right up. So we don't have any IV tubing, but I did have some IV fluids and was able to get a catheter, and I'm gonna just bolus her this 500cc bag of fluids to try to rehydrate her a little bit. That's about all we can do at this point, besides the next thing is maybe sending her to the hospital.
Her name is Kinette Michel. She is 14 and her parents can't take care of her. She is currently living with her aunt and uncle to clean and cook for them. They feed her when they can. We will be back with Michel later.
We saw a lot of well kids who just had little bumps and bruises, and then there were some very serious cases too. One child likely had typhoid meningitis when she was a neonate, and unfortunately we saw her. She was 6 months old and blind and deaf and really could not move very well, and her mom just knew something was wrong with her, so we had to explain to this poor mom how her child couldn't see or hear and would likely struggle with many things throughout her life. But we were able to make a neck brace for the child and a papoose so the mom could support it better. And this is a poor mom who's a widow, lost her husband in the earthquake, and lost her house, was really living on the streets with this severely developmentally delayed child. Very, very sad. So we gave her food and shelter, a tent. She came back today and I saw her, and there was a smile in her eyes. I'm kind of welling up thinking about it. And her child looked comfortable. So still a very sad story, but I think we made a small impact in her life, and I think she knows that we cared. And we all had a group hug after we were done with her, and she told our interpreter that she is praying for us, that she's so appreciative. That was a special story.
Oral health is so important to the public. If you can improve oral health, you will increase the lifespan of a population. So we try to bring dentists as well. We run a full dental clinic. This is primarily for the dentist for extractions.
So we're here, and we started out with just a few people, and I think that it's a true sign that they're in a lot of pain, kind of desperate situation to get some of these abscessed or infected teeth out, because now you can see there's actually quite a long line out here They obviously want to get some relief from their pain. They're not able to sleep, not able to eat. Some of these infections can spread down into their neck or up into their upper face by their eye. And so they're really just desperate to get these teeth out. So, you know, you start out with a few different people and then they find out that we're taking out some of these teeth, and so they just start coming in by the dozens. So now we've got about 20, 25 people in line just waiting to get their teeth out so that they can get out of pain. So it just, bless their hearts, they're able to come here and stand in line and wait for this to happen. We just hope we can help out as many as we can.
For the doctors, we try to bring a wide variety, but on this trip, they go back to their basic medicine. Even if they're a trauma surgeon, if we're out in the field, they will act in general medicine. And they really do rise to that occasion so easily. They truly become their original training to diagnose and to treat and to simply hold hands. A big part of what we do is holding hands and making patients feel better.
There's no question. These conditions are taking their toll on the natives. We're seeing a lot of patients in the clinic who actually their main complaints are just that of, when you ask them what's wrong, they just say they have a headache. The mothers complain that their children won't eat. Oftentimes their only complaint is pain. And once you sit down and talk with them and you ask them when that all started, every one of them says the same thing. It started with the earthquake. And that's post-traumatic stress. They're trying to deal with what happened and how they're going to continue to live their lives here. I mean, we're going to get on an airplane and go home. They're going to continue to live here, and they've got a huge challenge ahead of them.
How did she break her leg?
Comment on fait cassation? Comment on fait cassation?
Non,
House fall down.
Was she trapped for an extended period of time, or they were able to get her out right away?
Est-ce que tu étais au moment, est-ce que c'est où tu es sorti?
3 jours.
3 days.
She was trapped for 3 days.
Huh? Oh, his father died. And
her father died?
House, yeah.
Tell her I'm very sorry for her.
You will get some pile de ça.
She was holding her baby?
Où tu es bébé? Petit bébé avant?
Bébé a été en bacabon.
Under the bed. Ah, you put that under the bed.
Tell her she's a wonderful mother for rescuing her child like that.
I'm from Port-au-Prince and I've been attending medical school. Then since after the earthquake, everything was destroyed and my own medical school was destroyed. So then right now I'm working with international medical relief as an interpreter and also as a helper, as a medical student. All my life I wanted to be a doctor. I just wanted to help my country. Then right now I'm looking for another medical school to go, which is not easy to find. Then I have a bad story about my life because I lost my father since I was 12 months. Then my mother was the only one who used to help me. Nowadays the situation becomes more worse for her. Then she's not able to take care of me financially. So I've been working with the IMR. I really appreciate that what they helped me because they helped me in many ways. Being with the International Medical Relief was the greatest success in my life because the International Medical Relief is one of the best organizations that I've ever been working with.
The first thing that I saw, actually, when I saw that Port-au-Prince was leveled, was actually hope. What's interesting is that over all these decades that NGOs have been coming to help Haiti, they come and they help specifically in Port-au-Prince because that's where the greatest need is. But that also creates the cycle where people come in from the provinces because it's only in Port-au-Prince they'll find help. Because there's something interesting that happened on January 13th. I heard people say, I'm going back to my hometown because at least there I can grow some corn or some rice that I can eat. And it just hit me. What if we decided to focus on rebuilding the nation rather than the capital? Because if we rebuild Port-au-Prince exactly the way it was before, it'll be a mistake. Because we're gonna have that same cycle where people are centralized in Port-au-Prince trying to find help because in their hometown there's nothing. So we're working on that campaign, rebuild Haiti, not Port-au-Prince.
Right now she's feeling better after we gave her the IV fluids and some medications, some antibiotics, and she just ate some crackers with peanut butter and some dried apples, and she's drinking some Pediatric. She's smiling and smile. See? She's much happier now and feels much better.
The most important thing that I'm going to take away from Haiti is that there is a feeling of hope here. Every patient we saw had been through a terrible trauma or a terrible tragedy, either in the recent past of the earthquake or prior to that in many other things that have happened to Haiti. But every one of them said, we will take hope back to our people. And your being here has helped us have that hope. And that's what I'm going to take home from Haiti, is that they are truly a country full of hope.
After being here for a week, it was definitely a life-changing experience. I feel blessed to have been able to work with these people after such a terrible tragedy, to be able to try and comfort them and heal them in some small way. I will go home feeling blessed for all the things that I have and America has, and the people of America. We are so blessed there. These people need so much help.
I've learned that what the things are that are really important. Things aren't important at all. We have way too much stuff. We need to care for each other much more than we do. My example is the way those families cared for those people, never left their side. In American hospitals, families come in and see their loved one for an hour and have to go home because they're too busy. We have too many things. We need to forget about those things and remember the people we live with.
International Medical Relief brings medical services, medicines, supplies, training, and education to global communities through all of their medical mission trips, often with dramatic life-saving results. Apply to volunteer, donate, or learn about International Medical Relief at imrhq.org.